Hey guys, welcome to Podiatry Practice Mastery. This is Don here, where I'm trying to help you bring your practice to the $1 million mark in annual kind of production for your office. The reason I'm kind of emphatic about this is because I think that's a good mark to not, I guess you wouldn't equate it to success because, money isn't the only thing that equates to success. It's kind of having a balanced life, in my opinion, and having a job and a career that you enjoy. I'm going to talk today a little bit, kind of piggybacking on something I mentioned a while back. I met a financial planner. We kind of talked about doing these CME courses and kind of doing it for primary cares. And a lot of times, what I've realized now is when I have kind of an idea, I just kind of let it ruminate in my mind, and I try to kind of add it with other ideas. And there was another kind of concept that I've been working on for a while. It's called who not how. So basically the idea is how you can get stuff done with other people versus you doing it yourself. I think by far the number one skill that I've ever learned is to do that with a scribe. Right? This has made my life much better now, 15 years into practice, than it was the last 15 years in terms of the quality of my notes, the amount of production, the just the enjoyment of life. And so this guy, he kind of said to me, "Hey Don, how come you don't put together like a CME course for primary cares or for doctors, primary cares, things like that, and then you would do it?" And so I was thinking about it, and then came initially what comes to my mind is something like, "Wow, that's a lot of work. That's too complex. I don't really have time to do it, and I don't have anyone to do it, so I'm not going to do it." And this is typically how I think ideas come. So, for example, if you've been looking at any of my stuff within Podiatry Practice Mastery, you kind of look at the stuff and you say, well, that's a good idea. I don't really know how to do it. I don't have time to do it, so I'm not going to do it. And then you miss out. And this is kind of a recurring, I guess, theme. But what if you could have someone else do it? That is the way. And then the other question you always think of is, well, heck, I don't want to pay anyone, right? That's what we all think. Certainly, my scribe was a good investment. It cost me about $30,000 a year, but it produces well over that in terms of my production, much, and then the quality of life. But let's talk about this whole idea. So, what happened recently is we have these reps that come in. We have a lot less reps now than we used to. There used to be drug reps and everything else. Now the only reps we have are usually like orthopedic reps for certain types of screws. And as of late, there has been this vein clinic. So this is a vein clinic. There's a vascular surgeon there. There's a doctor. Her name is Dr. Pamela Kim, and she's in a nearby city here. And I've visited her. I kind of refer patients with venous insufficiency, and they have a whole bunch of reps for working for these doctors. And these reps, they kind of go and visit the referring doctors, the podiatrists, and the other types of specialists that refer patients to their vein clinic. So this guy, Dylan, he came in the other day, and he always brings in these great like cookies, which I don't eat until I get home, but I brought home some for the kids. But what happened with Dylan is I sat down and chatted with him, and I would say, Dylan, how can I get someone like you to do that for my office? Because we have 4 doctors, and I would love to have a practice rep. And I remember this idea came out a few years ago within the AAPPM, was having your own practice rep. And I always I know it's a great idea, but I'm like, how can I find someone like you? And how do I pay them? And I was kind of picking his brain, and he said, well, Don, I could just do it for you. And I was thinking to myself, well, how am I going to pay you? He said, well, you don't need to pay me because I already have to go to see the similar doctors because they're referring to us as well. It's just kind of another offer. And I thought I kind of got intrigued. Now I've tended over time to kind of calm down my excitement because I tend to find people are a lot of times have a lot of talk, but they don't do much. And so I was just kind of thinking about the idea. And recently, maybe about 6 months ago, I was asked to do a talk for all of these vein clinic reps, and they do like EVLT for the veins and different vein procedures in the office. And I did a talk for them, kind of saying about like on our end of things as podiatrists, what you should talk about, how you can get in to see us, how we can refer to them. And this gentleman was kind of his higher up, his manager. And so I said to Dylan, I said, Dylan, well, you could I'd be happy to have you try it, and let's kind of get a process. And then he asked, well, what do you have for one pagers? And I'm like, what in the world is a one pager? I don't even know what a one pager is. I said, all we have is business cards. He says, well, business cards are okay, but he recommended a one pager. And so I said, let me look at your one pagers. So he gave me 3 one-pagers. One was about Pamela Kim, which is about the doctor, kind of about the clinic, building credibility, things like that. Another of them were about 2 of the other things. Like one was like the general things that they do in the office, like varicose veins, venous stasis, dermatitis, venous ulcers, edema, and things like that. And the other one, I think it was something else similar to that. But basically, they're kind of one-pagers, kind of introducing it, like glossy pages, front and back. And then the next thought I had was, oh my, I have to make up one of these things. Once again, I don't have time. I don't want to spend money. It causes what we call a ceiling of complexity. How am I going to do this? So it was his idea. And then so what I did is after he left, I'm like, here, take some of my cards. Let me figure out how we're going to do this. And I sent it to his boss. I sent over to his boss and I said, hey, do you guys have any design people that can make these for our clinic, because we need them. Dylan's going to help us out a little bit. Would you be able to do this? So once again, getting Dylan to do the outreach for us, and then giving him the one pagers. Once again, it's like a win-win, right? Just because he's doing these nice things for me, I'm going to be more likely to give them referrals, right? Makes sense. And so he is kind of developing these one pagers. So I gave him a couple of links on our website, so for the pictures and for kind of what we do. And he's going to have his designers design like a doctor's one pager, one for like the two main things I wanted to focus on were like heel pain, which would include plantar fasciitis and Achilles tendonitis, and then also Swift laser. Those are the 2 things I'm kind of trying to market right now. They're cash pay. I think there's more leverage able with those, and so that's kind of what the plan is. And then just so luckily, kind of going off that idea of using other people to do things for you. Another thing I've been kind of brainstorming about this whole Swift thing. So this Swift is new to us. I've done my first 2 treatments. I want to thank everyone that did answer me in the email when I sent out an email asking like how you did it or did tips. And a lot of people gave me some great tips. The best tip was actually to hold it lightly on the skin, and the other one was to squeeze the foot or squeeze the skin, because I think that pressure kind of takes the pain off. But it was I kind of equated to almost as painful as our laser, not quite as painful as our laser. And then there's no pain afterwards, unlike Cantharidin and things like that. But what happened with that is as I was thinking about that, I was thinking, well, what I would really want to do to market the Swift would be to get in front of pediatricians, dermatologists, and primary cares and like urgent cares that could send their warts over to us. And I wasn't quite sure how to do that either. And so once again, instead of me kind of running out and sending letters to all these people and going out and meeting them, which I didn't have time to do, and I don't have a rep, I reached out to, this is just kind of an idea of how you guys can kind of think outside the box of using other reps. We have a pathology company that we use, and it's Quantum, and they do a great job. I know the rep. He's nice, friendly. All these reps are nice. And when we got Swift, I said, out of curiosity, I called him up. Would you be willing to kind of give me some of your ideas on how we could get in front of different doctors with this proposition to take care of their warts if they don't want to take care of them? I know some of them like to take care of them, but if they're not getting better, they send them to us anyway. And he's like, yeah, I'll help you. I'm going to visit. I know all the dermatologists that we pick up pathology specimens for, so I could go and meet them and kind of give them your information. Say, I know, Central Mass Podiatry, we're willing to do that, and I'd be willing to kind of do that for you. So I thought that was kind of a cool idea. So he is going to do that for us. So once again, I'm trying to make up these one pagers on Swift or on warts that they can give out to the other clinics. We'll see how it's going to go. I will kind of pass this on to you as I'm talking about the Swift marketing and different ideas within Swift. But I want to talk about one last thing. And then the last ask was, remember I told you my buddy that recommended we do like a CME lecture. And I was thinking, how in the world am I going to get like I guess actually I'm asking you guys. So if you know any other great ideas of, marketing Swift or getting other reps to do things for you, let me know. I'd love to just email me down at podiatrypracticemastery.com. I'd love to get your feedback. Or if you have any questions on how I do it, just email me. But the last thing was, how can I get the CME stuff going? And and the way I did that was with this asking those two reps, both the pathology rep and the vein rep. I'm like, do you guys ever do any CME? Do the doctors do any CME or things like that? So yeah, we offer CME all the time, and we would be able to potentially set up like a lecture where we could do part of the lecture and you could do part of the lecture. We'll fill the room, and then the idea of that doing the CME isn't so much for the CME for the doctors, it's getting butts in the room so that they would send us referrals, right? And developing that goodwill. So it's just kind of a way of thinking outside of the box. If you're trying to think you have to do something, how can you get someone else to do it? I think that's a smart way of thinking about it, using this concept, who not how. This who not how isn't my concept. There's a good book called Who Not How by Dan Sullivan and Ben Hardy. It has good ideas. I would recommend kind of reading it if you haven't. But I'd love to know your thoughts on these ideas. If you've tried any of these things, if they work for you, please reach out to me. Okay, guys. Thanks. Have a good one.